The ML7 provides the ease of use and versatility necessary to treat any type of LASIK patient. First, select a 100 or 130 micron head based on the flap thickness preferred for your next LASIK patient. The surgeon has an option of 6 calibrated LASIK blade dimensions. The plano is the standard dimension that is best to start with to gain experience. There are 3 minus dimensional options that create thinner flaps and 2 plus dimensional options that create thicker flaps. Using the vacuum ring nomogram located in the ML7 operator's manual, select the proper vacuum ring for your next patient. It is important that the vacuum tubing is replaced routinely to prevent the inline filter from clogging. This filter prevents fluid from damaging the pump and internal components of the console, reducing the need for costly service and downtime. The Lieberman wire speculum is ideal for use with the ML7. Ensure the ML7 is properly set up as described in the ML7 surgical setup training video. To ensure proper centration, the surgeon marks the center of the cornea, not the pupil, as the pupil may be off-center, risking flap decentration. Only 2 to 3 drops of fluid are needed to lubricate the eye thanks to the chromium coating, which ensures smooth movement across the cornea. Depending on the surgeon's preference, the handpiece assembly can be positioned so the hinge is nasal, temporal, or superior. The temporal position is recommended because it allows more space to lay the flap during the excimer treatment. The surgeon gently places the handpiece assembly onto the cornea by using the marks on the vacuum ring to mate with the markings on the eye. There are 3 hash marks on the vacuum ring, 1 on each side and 1 in the front. It's also possible to use the ML7 system without a speculum for patients with deeper fissures or hyperopic patients. It is recommended to set the vacuum at 550 to 600 millimeters of mercury depending on surgeon preference. After the vacuum ring is properly placed on the cornea, the surgeon then activates the vacuum by tapping the round black button located in the center of the foot switch. Do not hold this button down. When the vacuum preset level is achieved, the console will produce a beep. This sound is an indication that the surgeon can then press the forward pedal on the foot switch, which activates the forward movement of the handpiece and the oscillation of the blade. The surgeon must keep pressing the forward pedal during both the forward and reverse movements to ensure an uninterrupted flap creation. At the end of the cut, the handpiece contacts the mechanical stop that controls the hinge thickness and automatically returns the head to the exact location on the vacuum ring where it started. The surgeon can then tap the black button on the foot switch to discontinue vacuum and remove the handpiece from the eye. The surgeon can then pass the handpiece to the surgical technician while the surgeon gently lifts the flap so the excimer laser treatment can be completed. When the excimer treatment is complete, gently wash the eye and place the flap back down to its original position, ensuring complete adhesion. After an antibiotic treatment, the patient can get up from the OR table, expecting excellent results due in part to the ML7 LASIK system.